Good afternoon, everybody. Thank you for being here. You can see today I am joined by Dr. Kander. He's going to speak in a moment. He'll also be available to take questions. Obviously, disaster recovery and COVID-19 response remain our top priorities here in Baton Rouge and around the state. The storms may have passed, but there's no doubt we still have a long road ahead of us to full recovery. As you know, and we certainly appreciate, President Trump approved my request for a major disaster declaration for Hurricane Delta. And so I encourage everyone affected by that storm, Hurricane Delta, who are in the approved parishes. And those approved parishes are Acadia, Calcasieu, Cameron, Jefferson Davis, and Vermilion to register for FEMA assistance. You can do that by visiting disasterassistance.gov or by calling 1-800-621-FEMA. That's 1-800-621-3362. And there are some critically important dates to keep in mind. Residents affected by Hurricane Laura have less than a week left to apply for that FEMA assistance. The deadline for FEMA assistance related to Hurricane Laura is October the 27th. The deadline for disaster unemployment assistance applications is October 30th. So please visit louisianaworks.net. That's louisianaworks.net for information on how to apply. Unrelated to the hurricanes, but still important, coming up is the deadline to apply for the Frontline Worker Rebate Program. This was funded out of CARES Act dollars. So far, over $33 million has been distributed to those who've continued working, put their safety at risk, and performing those essential functions delineated in the bill that created the program, but really working for all of us during the pandemic. Also, due to the impacts of Hurricanes Laura and Delta, the Louisiana Department of Wildlife and Fisheries is extending the application deadline by a month for the $14.6 million in financial assistance available to Louisiana's fishing industry that were hurt financially by the COVID-19 pandemic. The new deadline is November the 23rd to submit applications. Because of the threat posed by mosquitoes after Hurricanes Laura and Delta, GOSEP was successful working through FEMA and also with the Louisiana Department of Health for approval for supplemental mosquito control assistance. Aerial spraying started on Tuesday evening in Acadia, Calcasieu, Cameron, Iberia, Jefferson Davis, Lafayette, and Vermilion parishes. And that spraying, I believe, is going to continue for the next 2 to 3 weeks. There are 3 Air Force C-130s that were made available by the Department of Defense, and we certainly appreciate that. With respect to sheltering operations, there are still 4,412 Louisianans in shelters. Of that number, 4,313 are Hurricane Laura evacuees, and they are in 10 hotels in New Orleans, 1 hotel in Baton Rouge, and 1 hotel in Lafayette. There are 4,267 of them in those hotels. There's a small number, I think it's 46, in the Alexandria mega shelter, and there are 0 in Texas. So we were finally able to get all of our evacuees back from Texas. 99 individuals are sheltering because of Hurricane Delta, and there are 36 of those in the mega shelter in Alexandria, and that includes those who are there for medical special needs. And there are 63 of these individuals in 1 New Orleans hotel. And obviously we are working to get these individuals back to their homes so long as they are safe, habitable, and secure, meaning that their damage was no more than minor. And we're working with local officials and through the fire marshal's office to make sure those inspections happen. If individuals need transportation back to their homes, we're providing that. And if And if they have their own transportation, then they make their own way. And it is the case now that every parish except for Cameron is welcoming individuals back home if they're able to get home. With respect to today's COVID update, we are reporting 775 new COVID cases today on 19,756 new tests. Very sadly, we're reporting 9 new deaths, and the total now is 5,593. 598 patients are hospitalized across the state of Louisiana because of COVID-19. That is 10 down from yesterday, and in the 3 previous days, we had actually increased by 58. And I will tell you, this remains the most concerning trend that I see in the data that we are reporting, and we're going to continue to monitor this very closely. 64 of those patients are on ventilators. That's down slightly from yesterday. And so overall, looking at the weekly report that comes from the coronavirus task force that operates out of the White House, and they do a state-specific report for all 50 states based on data related to cases and positivity and hospitalizations and so forth. Louisiana is stable and the lowest number of new cases per capita of any southern state, and we can be thankful for that. However, I can tell you that we still have work to do and a ways to go. But we can be thankful that we have the lowest number of new cases per capita of any southern state. We also have the lowest rate of positivity for our new tests in the South, according to that same White House report. I will tell you that we are not testing as robustly as we would like in the month of October because of the disruptions caused by all the recovery efforts related to Hurricane Laura and then exacerbated by those related to Hurricane Delta. However, we have completed more than 330,000 tests thus far in the month of October. As you all may remember, our minimum monthly goal is 200,000 tests per month. We're already well above that, and we are trying to test as many people every day going forward so that we can get that number just as high as possible. It helps to have robust testing in place because that's the only way to know what's happening with respect to positivity rates in the communities, where your cases are developing, and it also allows you to do contact tracing and so forth, all of which is important if we're going to minimize the spread and reduce the number of people who get infected and need hospitalization, and ultimately the number of people who die as well. And so while we are thankful that we're stable, and in many important respects we're leading the South now in terms of having the best numbers, there are some trouble spots, and we do have some parishes that are above 10% in positivity. And so we certainly need to continue to work on that. And more importantly, we're still losing people every single day. Every day I give a number, and those are moms and dads and grandparents and aunts and uncles and sons and daughters. And I'm very sad to report that we recently lost a 29-year-old college student to COVID. Dylan Parker was a forestry tech student at Central Louisiana Technical Community College in Winfield. He left campus 13 days ago with what he thought was a sinus infection. He was soon admitted to the hospital, and tragically, he did not recover. That's just one of the almost 5,600 deaths that we've reported. But I do highlight that so that we can kind of drive home the point that these are not numbers. These are our brothers and sisters out there. And I ask you to keep his family in your prayers during this difficult time. I do ask you to continue to adhere to the mitigation measures that are in place, because that is what's allowing us to do as well as we are. And quite frankly, if more people participated in them and adhered to them, we'd do even better. But wearing your mask or other face covering is critically important. Physically distancing from those who are not members of your immediate household, critically important. Washing your hands frequently with soap and water, staying home if you're sick, and certainly protecting the most vulnerable. And getting tested. is really important too. So we're asking people to make sure they're taking advantage of the testing opportunities in their area. So I'm going to pause now and ask Dr. Kenner to come up. He's going to touch more on our COVID efforts. He will be available for questions when he finishes speaking, and then I will come back up and finish my prepared remarks and then take your questions as well.
Thank you, Governor. Afternoon, everyone. I wanted to say a few words about Mr. Parker and his family. I don't know him. I didn't know him. I certainly don't know his family. But I am an ER doctor, and I've had the responsibility of conveying similar news to quite a number of families who didn't expect to lose a loved one, particularly someone so young. And so I have somewhat of a sense of what they might be going through from that experience. And I'll tell you, the thing about COVID and the statistics is that it's easy to get trapped in them and make a conclusion that might not be accurate for you. What I mean by that is there's no question that younger individuals on average do better if and when they do get COVID. The challenge with that is it's not absolute, and those statistics don't mean a darn thing if it's you or your family member that gets it. And that's what's so hard about this. COVID it's almost like a game of chance. If you get it, you have a chance of doing okay. If you're young, you probably have a little bit of a better chance, but that's not absolute. And I don't know a whole lot of people that are too eager to take that chance. And when we have news like this young individual who passed, it really hits home for all of us, because just because the statistics say you might not be likely to get really sick or have a bad outcome, that's no guarantee. And I think that needs to be a warning to all of us as we go into what could be a season with considerable risk out. There's a lot about COVID that we have a really good sense about. There's a fair number of things that we're still learning, and in the middle of that, there's a lot of nuance. One example of that is the CDC announced a couple of days ago some revised definitions on what constitutes to be a close contact. And typically, we think of a close contact as someone who is within 6 feet for about 15 minutes or longer period of time, someone that has COVID. And that's a general sense. What the CDC clarified a couple of days ago is that 15 minutes need not be consecutive. It can be cumulative over the course of 24 hours. 5 minutes here, 5 minutes there, 5 minutes there. That's enough. We actually, in Louisiana, in the Office of Public Health, have been practicing along those lines as a result of some earlier conversations with the CDC for a number of months. So that had been the practice. But it goes to show that where the risk is, it's not always cut and dry. Sometimes there's nuance, sometimes there's a conversation in that. What is clear at this point with the evidence is that distancing, masking, being outdoors, and washing your hands are effective. There is absolutely no question about that. And as we go forward with the months ahead, we're going to have to keep that in mind. Now, there are a few things I wanted to convey about the situation that we find ourselves in. If you look around the country right now, as the governor mentioned, we are one of the states that is not experiencing a marked increase. We're really the only state in the South. And if you have to look at a map, almost every non-coastal state is experiencing an increase right now. And we've been doing very well. Now, I will say, we see some signs that we might be experiencing an increase. 3 of the past 4 days, as the governor mentioned, we had increases in hospitalizations of COVID-positive individuals. We're starting to see the beginnings of what might be trends in a number of regions across the state of increased cases. Now, we're going to watch that closely and see what happens. But up until now, we've been doing quite well in Louisiana. The reason why that is because folks have been attentive to what we know works. I think folks have been wearing a mask when they need to. They've been distancing when they need to, they've been washing their hands, and trying to do as many things outdoors as possible. Going forward, we're going to continue to have risk. There's risk every day, and every day we're kind of doing more, and more things are being brought online, and that's a good thing. But if we don't keep those core principles in mind, we're going to end up right where a number of other states are doing right now. Let's not do that. As we go forward, let's continue to do the things that we know work, which is wear a face covering when you're close to somebody else, stay outdoors if there's any way to do that, distance 6 feet when appropriate, and wash your hands frequently. That's what's going to keep us safe. Looking forward, we've got Halloween, there's Thanksgiving after that, and of course, there's all the activity now that wasn't in place a few months ago. So let's do all that we can to not backtrack on that. I'd be happy to answer any questions if there are any.
Thank you, Dr. Cantor. And I was going to come up and talk about Halloween and Thanksgiving and other holidays and ask people to please be mindful of the fact that we have this ongoing public health emergency, COVID-19, and make sure that we adjust our activities and make sure that we conform our behavior to the mitigation measures. It's just critically important that we do that. And Dr. Burks and others continue to point out that it's not just the large crowds and the big gatherings and so forth, but that more and more spread seems to be happening in relatively small, informal settings at people's homes, whether inside or in the backyard, around birthday parties and barbecues and so forth, because the presumption that many people operate under is that if someone is your close relative or friend, or maybe a neighbor, that they don't have COVID. Well, you can't know that, especially when 40 to 50% of all the people with COVID are asymptomatic. And so there's an awful lot of spread that takes place in those informal gatherings where people, for some reason, develop a sense of security that causes them to lower their guard, if you will. And so we are asking people to pay attention to that as well, and take advantage of the improving weather we have with respect to humidity and temperatures, and get outside. And again, outside is not 100% safe, but it's safer than indoors. And outside, with all the mitigation measures in place, is the safest, period. Do want to remind people to get the flu shots, incredibly important, even if you've never had a flu shot before. It's important that you get one this year. And they're available at no cost or low cost and in every community across the state of Louisiana, so please do that. One change to the emergency order that we will make either today or tomorrow, but it's going to be effective tomorrow, and I wanted to go over that with you. After meeting with the Speaker and the President, and based on their request for me to consider certain things, and it's a change that I am making with respect to outdoor high school sports. We are going to allow stadiums to move to 50% capacity if they are in parishes with a percent positivity of less than 5% for the previous 2 weeks, based on the most recent report from LDH. It's a similar approach to what we took with bars. However, we're not going to require that schools or school districts or parishes opt in. Their capacity will be 50% if they meet the criteria. I can tell you right now we have 26 parishes that qualify. And as with bars, if a parish's percent positivity gets back up to 10% or more, or I should say over 10% for 2 weeks, then they will go back to having a 25% capacity. Trying to make sure that we can expand the capacity as we're able to do so safely, and tying it to the percent positivity, the degree of community spread is the safest and I think the most responsible and the most consistent way to do that. So as I mentioned, we're going to issue this executive order to be effective tomorrow. We'll show you the text once I sign it. I do want to remind people that you still have to social distance to the maximum degree that you can. The mask mandate remains in place. And indeed, as we've seen since July, since we put the mask mandate in, that's when our 2 weeks, you can literally look at the calendar. And 2 weeks after the mask mandate went into place is when our numbers started coming down. And they're not coming down anymore, but they're not going up either. But that mask mandate applies to this as well. And it's one of the reasons why we believe that we can do this safely where we have low amounts of community spread, as evidenced by that low percent positivity. I do want to remind everyone, if you are vulnerable, you shouldn't be going into crowds anywhere. And that certainly includes a football game. And so if you're 65 or older, if you've got those underlying comorbid health conditions that predispose you to a poorer outcome should you contract this disease, whether that's heart disease, kidney disease, hypertension, diabetes, obesity, you really need to avoid crowds, and that certainly includes football games. All right, so with that, I am going to take a few questions today, and I suspect Sam has his hand up. Sam?
Thanks, Governor. On the change to the emergency order, there's been talk recently under the assumption that you're going to veto the emergency powers bill they gave you, although I know you haven't made a decision on that yet, that some members are talking about the petition again. Do you think this change, you mentioned you did this sort of, I guess, at the request of the House Speaker and Senate President, do you think this is going to quell that and satisfy the legislature in terms of the frustrations they had with your emergency powers?
Well, I don't know. But I will tell you that my communications with the Speaker and the President predate this particular conversation. I mean, they go back months, and there have been other adjustments that I have made at their request, and when I can do it and feel comfortable that it's a safe thing to do. And so we're going to continue working together as best I can. As to how this is received by members of the legislature, I mean, that's a question better directed to them than to me. But when you direct that question to those frustrated members and so forth, I'd ask you to ask them, which of my decisions are inconsistent with what I'm being asked to do by the White House Task Force? Which ones are not supported by the science and the data? And I know that people are tired of COVID-19. I'm one of those. But the fact that we're tired of it and get fatigued by it doesn't mean it's going to go away. It's as contagious now as it's ever been. It's extremely deadly. I think there have been more Americans lost to COVID since March than those lost to flu in the last 6 flu seasons, something like that. So I mean, that's what we're dealing with, and it's here. It's, you know, the federal government has extended its declaration of emergency. We've done that here in Louisiana, and that's because we're in a real emergency. And if you're in an emergency, you have to be able to manage it. And if you're not going to manage it, then I guess we don't need to have an emergency declared. But as governor, as the person in this state charged by the Constitution with the authority and the obligation to do the very best that I can to protect public health by managing this public health emergency, I'm going to do everything that I can to strike the right balance between protecting public health on the one hand and keeping our economy open and our schools open and as much normalcy as possible. And my last comment about that is back regarding the mitigation measures. If we want to have as much normalcy as possible without overwhelming our capacity to deliver health care in our hospitals, without people dying needlessly, without people getting really sick needlessly, we can do that. But you have to adhere to the mask mandate. You have to wash your hands and physically distance. If we will do those things, we can enjoy more normalcy. And the thing that I just can't understand are the people who demand that we have no restrictions whatsoever. Everything should be open at 100%. And by the way, don't even ask us to wear a mask. Don't tell us we need to wash our hands or physically distance. I mean, there's just not anything reasonable in that conversation. But I am inclined to continue to engage in reasonable conversation every time I'm given that opportunity. And so certainly that applies to the legislature, and my communications and dialogue with them will continue. Yes, sir.
Hey, Governor. I was wondering what you thought about the $20 million in pet projects from the supplemental budget bill, and if you had any intention of vetoing them.
Well, first of all, I'm not going to veto the bill. The supplemental appropriations bill is very important, and it does a number of critical things that we asked for, and that includes another $85 million of CARES Act funding that will go to the Unemployment Insurance Trust Fund, which is sorely needed, but also additional money for GOSEP to manage emergencies, additional $5 million to the local portion of the CARES Act. There's funding there for critical priorities in the parishes most affected by the 2 hurricanes. And so an awful lot of good work is there as well. As you mentioned, there are a number, I think it's 113 individual projects, and we'll continue to go through those. Right now, it's safe to say that not all of those will survive the veto pen, but I'm just not prepared to give you a blow by blow which ones will and which ones won't. But I've had an opportunity to look at enough of them to know that they're not all going to survive. But I suspect most of them will, and that's just part of the give and take between the different branches of government. It's not what I asked for, but at the same time, it's what large majorities of the House and the Senate decided that they wanted to do right now. And many of those projects, as I mentioned, are many of those appropriations, I should say, are incredibly important as we try to recover from the hurricanes, as we recover from COVID. And I'm mindful that the economic downturn related to COVID has had a negative impact on some local governments that will be benefited from some of these appropriations too. So there's a lot of things to balance. I will sign the bill. They did a lot of really good work in there, but it's fair to say that some of those line items will not survive the veto pen. Yes, sir.
Governor, a lot of hurricane evacuees in recent days, I think more than 1,300 have been told to leave their hotels and go back home because they've been assessed as minor damage in their homes, even though a lot of these people say they don't have minor damage and they don't feel comfortable living there. And they kind of describe a sort of complicated, stressful process in trying to get someone there, reassess it, go back through the mega shelter. Wondering, do you think there's an easier way to do these assessments instead of having them all trek back from New Orleans to Lake Charles in person?
Well, first of all, we are looking at their homes before we ask them to come back. The Fire Marshal's office by itself has done 125,000 inspections of structures, mostly residences, but also some businesses as well. And that's in a database. And others, local government is also doing inspections. And the categorization of damage as being minor as opposed to major, severe, or a home being destroyed, you know, I guess people can disagree on that. When we put the minor label on the damage to a home, what that's supposed to mean is, yes, the home is damaged, but it is safe, habitable, and secure. And we do that in every case as best we can before we ask people to return home. If we do that and someone returns home and they disagree, then we will go back out and take another look at that particular residence. But one of the things we have to be mindful of is that Hurricane Laura happened many weeks ago. And while we have support from the federal government for non-congregant sheltering, it is not going to last forever. And we just can't keep people in the hotels forever. And in fact, at some point, if it appears that they can safely return home, then if they stay in the hotels, that's not going to be reimbursed. because it's no longer necessary. So trying to figure out which of those individuals really should not be living in those homes and which ones should, it's an arduous process. We're working it as hard as we can, and we're doing everything we can to advance the interest of these individuals and make sure that they do reside in a place that is safe, habitable, and secure. But it's just not an easy process, especially when you look at the sheer numbers of folks that we had. But the fact that we still have LARA evacuees in hotels tells you that we have made an unprecedented effort to shelter people after this storm, both because of LARA but also because of COVID, to put them up in hotels. I mean, we've never done this before. But there comes a time when you have to wind that down to the degree that you can. And one of the things that I will insist on is that we're going to work with those individuals who believe their home is not habitable in good faith to make sure that they're fairly treated. And for those individuals who cannot go home yet because their home was destroyed or has major or severe damage, we're going to make sure we have non-congregant sheltering for those going forward.
One follow-up to that.
Yeah.
There was a document passed out to these people that said mold is not going to be reason enough for you to get upgraded to a major. Who made that decision? And I guess why is mold not enough if their house is filled with mold and it's been out of power for weeks? Why is that not enough to earn them a state hotel?
Yeah, I'm not sure. I'll get you an answer. And quite frankly, I haven't seen that. I'll take a look at it and we will get you an answer. Yes, ma'am.
Governor, we have some of the highest COVID-19 numbers in the country at the beginning of the pandemic. Is there any indication that we are starting to see any immunity here in Louisiana?
Any what?
Immunity to the virus.
No. I mean, for those individuals who've contracted it and recovered, I believe it's safe to assume that they have antibodies that will protect them for some period of time. I don't know whether or not, I can ask Dr. Kenner to come back up. I don't know whether we say they have immunity, because I think that many people may believe that means forever. And we don't know whether those antibodies that are produced by the body in response to the disease last forever. And in fact, there seems to be growing anecdotal evidence, at least, that that's not the case, because we are hearing of reinfections, not in big numbers, and there may be something else to explain these cases, and they're not true reinfections, but it's possible that those antibodies are not lasting long enough to protect people after so many months. And then maybe that varies by the individual too. But what I can tell you is, and Dr. Burks made sure that I was aware of this when she visited recently, less than 10% of the people of Louisiana have contracted this virus, which means more than 90% of Louisianans remain vulnerable to it. And so if you're getting at herd immunity, I think typically you have to get at least to about the 70% level before you can talk in those terms. Well, that's about 7 times as many people have already had it. So we're nowhere close. And I would pray that we don't get there, because if we do, then that means about 7 times the number of people who've been in the hospital will have to go to the hospital. And I would guess that not 7 times as many people who've died would die, because the practice of medicine has improved with respect to COVID. But I don't know what that number would be, you know, and so we know 5,600 have died in Louisiana thus far for less than 10% of the people to contract the disease. So when you try to get up to 70% or so, what is that, 5,000? I mean, is that 50,000 people? Is it 60,000? I don't know. But we shouldn't try to get it that way. We should try to make sure that we protect ourselves as best as possible, and then the herd immunity comes with the vaccination. And in fact, farmers do that with their animals. They vaccinate their animals in order to create herd immunity. They don't want to lose them, and we should regard human life with as being at least as valuable as cattle. Yes, ma'am.
Are we any closer to a vaccine? Or what, I mean, I know
Well,
it's
yeah.
generic.
Obviously, every day that passes, we're a day closer. I just don't know when that's going to come, and nobody does, because the trials are not over. When the trials conclude, they will be able to analyze the data pretty quickly to find out whether the safety is there and the efficacy is there. And I know that of the 4 major pushes in Operation Warp Speed, 2 of those have actually been paused, 2 continue, and we hope that there will be a vaccine soon, but ultimately there's going to have to be a number of vaccines because they try to figure out which group of people have the best result with each vaccine, and so not everybody's going to take the same one. It's going to depend on your characteristics. We don't know yet whether some of these vaccines are going to be one and done, or you're going to have 2 shots, or you're going to have an annual booster. Is the first vaccine that comes out going to be the one that has to be stored at -30 or -60, and so you can't do it through the normal pharmacies like we do, for example, the flu shot? We don't know the answer to these questions yet, but I'm routinely updated through the White House Coronavirus Task Force calls on the progress being made, and I can tell you this is the most expensive, biggest effort in human history to develop a vaccine as quickly as possible. I will also tell you that I will feel very comfortable that once the Food and Drug Administration puts its stamp of approval on a vaccine, that it is in fact safe and effective. I just don't know when that's going to be and when we're going to be able to administer it to enough people to get this virus under control. Sam?
Do you think the legislature should go ahead and wrap up its work and adjourn for the session today or this week?
Well, I think so. The truth is that they don't seem to be getting a whole lot done right now. And so, at this point, I don't know. I mean, they obviously issued a call where they can go through Tuesday. I would hope that they don't do that, but that'll be their prerogative if they do. But from my perspective, it doesn't seem like that would be a wise investment of their time or of the public's money. Yes, sir.
There have been some talks that the mailing system might be overwhelmed with much more mailing ballots this election season. Do you anticipate that being a problem in Louisiana?
I don't, I haven't heard that that's going to be a problem here. I know there was some general discussion around the country at one time, but unlike other states, while we do have an emergency plan in place that allows for more individuals qualified to vote by mail, we don't have a system in Louisiana where every registered voter gets sent a ballot that they can return by mail. We don't even have a system where everybody who wants to vote by mail can. You have to fit a certain category in order to be able to request that mail ballot. And so it's a smaller number here and smaller percentage of voters than in many other states. And then the guidance is to get that ballot back in the mail so many days before the election, just to make sure that it arrives timely and it gets counted. So I don't think we're going to have a problem here. I certainly hope we don't. And I can tell you, I have not been told that anybody who's watching the election in Louisiana as it relates to mail ballots thinks that there's a problem. So if that develops, I'll certainly try to let y'all know. One more question? Yes, sir.
If you're changing the capacity of high school football to 50% age, plans to change anything else?
No. All right. Look, thank you all very much. Our plan will be to have another one of these sessions next week at 2 p.m. If the need arises to apprise the public of something between now and then, we'll certainly let you all know. I want to thank you for continuing to cover all of these important issues, whether they're public health emergencies, storms, or what's happening here at the session. And then I do want to conclude with one more appeal to the people of Louisiana to make sure that we continue to do those things that have worked. We know that they're working. And to the degree that we will adhere to these mitigation measures, we can achieve more normalcy and in terms of the economy and how much is open and schools and whether it's K through 12 or higher education and so forth. And then as we get ready for the holidays, please take all this into account. And the holidays should not look like they did last year. It really is just that simple. We have to do things differently and we have to do things smarter. So we're asking you to do that. And continue to lift up one another in prayer. And I want to thank all the people for Louisiana, because we are, at least as today, and certainly things can change and they do over time, but today, related to new cases and related to positivity, we have the best results anywhere in the South currently. The best data to report. We're stable. I wish we were still declining, but at least we're not currently surging, although there are some early indications, as Dr. Cantor mentioned, that we may be heading in that direction. So let's do what we can. Let's lift one another up in prayer. Be good neighbors, and we will see you next week.